All right, so will this Senate bill really do what it is being sold to us as and keep costs down in the long run? The trends say it's unlikely. Your next guest says we are literally eating our way out of billions of dollars. Joining us now is Ken Thorpe. He is Executive Director of the Partnership to Fight Chronic Disease. He is also former Assistant Secretary of Health Policy at the Department of Health and Human Services. Thank you very much for coming on, Ken. Listen, I was writing about this last week, or earlier this week, actually, and the blog was a little bit snarkily titled, Healthcare, Schmelthcare, When Do We Get to the Hard Stuff? And I talked about obesity, and we've talked a lot about this plan, putting people on insurance. It's great for people that don't have insurance. But the reality of it is, until we tell people that they've got to take care of themselves, why will the cost curve ever bend down like we're being sold it will?
Well, you raise a good point. There's really the two statistics that I think Americans should keep in mind here is 1/3 of the growth in healthcare spending over the last 15, 20 years is due to the doubling of obesity, now standing at about 34%. And second is that about 3/4 of what we spend in healthcare is linked to chronically ill patients. Those patients with diabetes, high blood pressure, bad cholesterol, and so on, all of those conditions generally linked to weight and excess weight. So we've got to take this issue on as a national approach if we're going to really make a huge difference in slowing the growth in healthcare spending.
Politically, though, it's very difficult, right? Because what you're saying to them, if you're a politician, you don't get elected or reelected by blaming your constituents for many of their own problems. But instead, we're just trying to figure out how to pay for people to be more unhealthy and live on prescription drugs for 40 years.
Well, you raise a good point. I think, certainly blaming people is not going to get the job done. What we need to do is identify programs that are effective in helping people to change their behavior who want to do it. And that really starts with making a difference in the school system, community interventions. There are some great ones that the YMCAs and others have run that really have shown to reduce weight and slow the progression towards diabetes. Workplace programs. We do have examples of very successful programs at the workplace where workers can manage their health care conditions and at the same time lower overall spending and improve their own productivity. So identifying programs at work and finding ways to make them more widely available, scaling them and replicating them, I think is really one of the challenges.
But do you think, Ken, do you believe that more insurance is going to help that? I mean, statistics show, Jay Bhattacharya at Stanford has done extensive work on this, that the more people have access to insurance, Medicare or otherwise, the more they consume it. What's the incentive, other than maybe your own personal concerns or whatever it might be, to stay healthy if you know somebody else is going to pay for you to get fixed or at least be, sort of constantly repaired throughout your life?
Well, you raise a good point. I think that designing insurance appropriately to encourage good behavior makes some sense. So, for example, encouraging individuals to participate in workplace health risk assessments and keeping on a care plan by giving them a financial incentive in terms of the premium.
How about this, Ken? Let's get to the meat of the matter, right? Should obese people pay more for insurance, period? 30, 40% more. On a state or Medicare level, whatever it is, if you're overweight, if you smoke, you're going to pay more for life insurance. If you have 4 car wrecks a year, you're going to pay more for car insurance if you can get it. If you're obese, should you pay more for health insurance?
Well, I don't know that I'd go that step, but I see where the logic of where you're going with it. I think we should find ways to make sure that we can incent people to make changes in their behavior financially and start with that. I think that rather than starting with charging people more up front, I think we build more resentment and make solving the problem a little bit more difficult.
Well, why is that? If it's costing everybody, why is it such a taboo topic? Why is it such a don't talk about it? Let's not talk about the obesity problem in America. You might offend somebody who's 300 pounds. At what point do we say we've got to start actually asking difficult questions and making some hard calls, as opposed to Congress, which just seems to want to throw money around at the problem as if that's going to solve the fact that 6 states now have 1 in every 3 of their adults obese. 1 in every 3 adults in 6 states is obese.
Well, it's potentially even worse. If we don't do something here, within 10 years, half a dozen states will have half of their adult population considered obese. So we need to do something, I think, quicker than what we've been doing on really intervening. And it starts with kids, adolescents. We can do a better job in the communities, and we can do it at the workplace. So we need to find a more aggressive approach here. I agree with you to solving this problem, because if we don't deal with it, we're going to have a continued explosion in chronic disease prevalence, and that is the key driver of rising healthcare costs.
That's right. Until somebody's willing to say things that politicians don't want to say, it's probably not going to get much better. Ken Thorpe, thank you very much for joining us. We'll see you again soon.